I'm going to talk about sleep. I've been a sleep physician for 25 years, and I heard someone throw the word La Jolla in the back, and I trained in La Jolla Scripps Clinic and Research Foundation 25 years ago when we didn't know anything about sleep. We know a little bit more about sleep, but not that much. We know sleep is universal. So even though this is the first time I talk to a survivor group like yourselves, I don't feel uncomfortable because sleep is important for this group, like any other group. Okay, so it's one of those things where it was easy to say yes because sleep is a universal theme. Now, I'm going to start with the basics. First of all, we don't know why we sleep. We still don't know. You know, there's several theories. One is to cool the engine down. That's the latest theory, because if we keep going, we will burn up and spontaneously combust. So when we sleep, everything slows down and everything cools down. We have a 24-hour clock, and this is our clock. We all know that we are very sleepy from midnight to 6, 7 a.m. We're also very sleepy from 2 to 6 p.m. We have a second peak of sleepiness. That's why in some cultures, they take a siesta. Italy, Spain, the Middle East, that is physiologically correct. We should be doing that. But in this country, it is very un-American to take a nap. What do? We drink more coffee. We keep going, right? Monster drinks, all these energy drinks. It's a billion-dollar industry because we measure production, how many hours we work. I recall, I always chuckle when I put someone on work restriction of 8 hours. They can only work 8 hours. That used to be normal. Now normal is 12 hours or 14 hours. Remember when we used to have day shift, afternoon shift, and midnight shift? There's no such thing now. Midnights is 3 p.m. to 3 a.m. And on some days you go to 4 a.m. with mandatory overtime. So there's no such thing as regular shifts like before. Part of our problem is we weren't built to be a 24/7 society. Okay, so it's just we never close down. And especially if we have some traumatic brain injury or some medical illness that slows us down, it's hard to keep up with society. I have 2 cell phones, I have 2 laptops, I have an iPad, and I keep losing things and I can't keep up. And so it's hard. Now, we have a circadian rhythm, and one of my colleagues took the time people die, the time people have asthma attacks, the time people childbirth, and it seems to be related to our circadian rhythm. More people die at night. Most asthma attacks or emphysema happen at night. Most heart attacks happen in early morning hours. Okay, so there is some relationship to sleep that we're not sure of. Now, like the father of sleep medicine said, sleep has to do something important or else evolution would have eliminated it throughout the years, right? Several thousand years later, it would have taken it away, or God would eliminate it if it didn't do anything, because we spend 1/3 of our lives sleeping, or supposed to be sleeping, okay? And now we make a big deal about, okay, I can't fix what you have, but we need to be concerned about brain rest, about saving the brain, okay? So no matter what underlying condition or medical issue you have, we talk about sleep being very important. And of course, I have a conflict of interest because all your other doctors look at you from the day, I look at you from the night, you know. I'm the night shift, as I say. Now, normally, we cycle, and these cycles are 90 minutes long in general. I'm being very simplistic, but we enter sleep through stage 1, 2, 3, 4, and then the blue represents a dream. We have 4 or 5 dreams every night. To remember the dream, you have to wake up during the dream. Okay, so we have people say, I never dream, I never dream. Not true. You have to wake up during the dream. Now, if you have very disruptive sleep, where you wake up frequently, you may not dream as much as you should. Okay, but this is normal. Now, babies, we think dreams are very, very important because babies dream 40, 50% of the night. And as we get older, we dream 20, 25% of the night. Okay, but it seems to be very important for our neurological development. Okay, slow wave sleep or deep sleep, 3 and 4, is also important because that's when growth hormone is released. That's when we repair ourselves. So sleep is very important for our recovery. And that's why if someone has some type of brain trauma or event, sleep is very important, the brain rest. And sometimes that may take a few months or a few years, but we focus on brain rest, at least from my end. Now, before we thought of sleep as a lot of nothing, okay? We just passed out. Now we know that that's not true. Sleep is very organized into different stages. And this is an old slide, and it's not you, it's me. The slide is a little fuzzy. When we dream, our brain is very active. Okay, it's almost like it's awake. Our EMG or muscle tone is absent. When we dream, we are actually paralyzed. That's why many of us dream that we're floating, or we can't run away from a boogie monster, or we're falling from a cliff. Don't ask me what happens if I fall and I hit the ground at the end of the cliff. I don't know. No one has come back to tell me what happens. Wake up, right, in a panic. Oh my God, they almost caught me or almost died. Our eye movement is rapid. If you look at a baby or your spouse or companion, you can see their eyeballs moving underneath their eyelids. It's almost like we're reading the dream. That's why it's called rapid eye movement. You see the eyes moving back and forth quickly. Autonomic nervous system, variable. That means that our heart rate is going up and down, our respiratory rate is going up and down, our temperature is going up and down. So it's like the body is testing all its equipment 4 or 5 times a night. That's why we wake up from a dream, we wake up in a panic, and our heart is going fast, and we're a little bit sweaty and breathing fast, but that's normal physiology. Now, for unknown reasons, men have erections during this time. Okay, again, has nothing to do with dream content because babies have this, and babies have not been on the internet to yet. And it's like the father of sleep medicine said once, and everyone was like really awkwardly quiet. He said, maybe that's the antenna to bring in the dream. So what does the other 50% of the population do? Well, they have a smaller antenna. They also have it's like they're testing equipment, engorgement of blood on everything. Control respiration altered. Now, when we're not during dreaming, it's very quiet, very still. Okay? So we can tell when you are dreaming, when you are not dreaming on a sleep test. Okay? Any questions so far? We don't think it's an antenna anymore. We're going to ask that. The nice thing about sleep, the father of sleep medicine is still alive, and it's fascinating the stories they tell on where we have gone in the last 50 years. And the nice thing about sleep is no one has the real answer, so we can sit in a room like this and speculate. It could be this, it could be that. And sometimes those are the fascinating discussions, and many times over these years we've been very, very right and looked very intelligent, and other things we've looked very, very bad and very stupid. But there were no video cameras back then to document everything. Now, like everything else in medicine, if you look back far enough, you will find it in the literature. Now, encephalitis, this was described only, and I hate to say this, only 100 years ago. But other problems have been described 300, 400 years ago, like restless leg syndrome was first described in the 1600s. Sleepwalking was described in the 1800s in the book Count Dracula. Pickwickian with Charles Darwin described obstructive sleep apnea. So if you look far enough in the popular literature and the medical literature, some of the things that we see now with sleep were described years and years ago. Now, from a sleep standpoint, and I know this is not what you guys have, but this is all what we have from sleep medicine. Encephalitis Lethargica is a rare disorder of autoimmune origin that predominantly affects the basal ganglia midbrain. This was described in the early 1900s, and this was at the time where World War I was going on, where there was a big influenza epidemic that destroyed millions of people's lives. During that time, the survivors at that time, there was one gentleman who recognized 3 different types of people who survived or suffer from encephalitis, and 2 of them had severe sleep disorders. Either they were very, very sleepy, or they had insomnia. Okay, and now we know it's where it affected the brain. Like many of you here, when you talk to each other, you'll see, but I don't have that, or I have this. And it depends on where it affected the brain, what part of the brain it affected. Because we have certain centers of the brain. We used to talk about an on and off switch for sleep. Now we know that's not true. It's like an orchestra. You have so many things over here, so many things over there. When you go to sleep, these turn on and these turn off, and then the other way around. So all day long, you're just shifting. It's like an orchestra deciding who gets to play louder at one time or another. Anything that can throw that off will obviously cause some clinical symptoms such as insomnia, or you're very sleepy all the time. And we can't predict. Okay, it's almost like 50-50. Insomnia is linked to lesions in the anterior hypothalamus, in the front of the brain. And people who are sleepy seem to have a lesion in the other, or the posterior part of the mesodiencephalic junction of the brain. And this again coincided with the influenza epidemic back in 1918. At that time they said this is a virus, but no virus was found, and now we're talking about being bacterial in nature with strep. How did I do that? Oh, since 1926, almost 100 years ago, high strep titers and elevated antibodies reactive against neurons at the basal ganglia, autoimmune mediated. Okay, so we're talking about autoimmune disease. Okay, so these are the only scientific slides I'm going to show. It's too early in the morning. Okay? But it's just one of those things. 100 years ago described, we think it's this. They were half right. It's not a virus. We think it's strep. A lot of these patients show up with an acute infection, like pharyngitis. And from our standpoint, people who suffer from this act like narcolepsy. Now that's something we can attach to, that's something we can know. Okay, encephalitis, what is that to us? You know, how do we treat that? We don't have a lot of experience with that, but when you start acting like you have narcolepsy, you're very sleepy, with or without cataplexy. Does anyone know what cataplexy is? No. Very, very dramatic. These are people that if you make them laugh, they'll collapse. And you think they're messing with you because they just drop into their food, or they'll just drop, or if you scare them, they'll drop. So they lose their muscle tone for a few seconds. And these are people who are misunderstood and characterized as they're faking it, for other reasons, or they have seizures and such. And it's a very dramatic event. And it just destroys their lives, where they can't drive because if they get scared, they'll collapse.
Well, I don't want them to drive.
They don't want you to drive, so there. Having said that, they're very protective. The Narcolepsy Network or their organizations are very protective of their driving privileges. Because what happens, once you lose them, it's very difficult to get. Okay? But in the state of Ohio, we don't have to report sleepy people. Other states have to report sleepy people. Remember, my perspective is sleepy people. Now, we know you have a traumatic event or traumatic incident. Your brain is affected. We don't have a cure for that. So it's what else can we do? Well, obviously, we have to protect the brain. We have to talk about brain rest. But we also look at comorbidities. What else may you have? But it's never one thing, right? That would be too easy. We're living longer. So we are at a higher risk of getting other diseases. I went to Tanzania 10 years ago, and they have no sleep disorders there. The Minister of Health says, I don't understand this sleep centers, I don't understand sleep apnea, because 2/3 of their populations are under the age of 21, right? They die of pneumonia, they die of malaria, they die of tuberculosis, they die of animal bites, but they don't grow old and sassy like us, old and fat like us. So they don't get the diseases that we get on later of high blood pressure, related to obesity, right? High BMI, the high blood pressure, and cholesterol, and all that stuff we get yelled at every day. One of the most common things, so let's say I see a patient with encephalitis or a survivor. We look for comorbidities. What can I do to help you recover? What can I do to prevent further trauma, incident? You say, what do you mean further trauma? Well, we talk about when we do CPR. Has anyone taken CPR here before? Right? Annie, are you okay? I always change her name to something else just to throw off that. Pedro, you okay? Pedro. What do they teach us? If Annie doesn't have oxygen for 6 minutes, Annie's brain dies. Okay? Annie's dead. Don't bring her back. But what happens if we are not having, if we're a little bit oxygen deprived for 2 hours every night, night after night after night? That has to do something. Okay? What happens to us if we wake up 200, 300 times every night? That has to be bad. Okay? Now, years ago we ignored that, now we're not ignoring it. You may be the type of person that says, I don't sleep a wink. This is not true. We saw you in the sleep lab, we videotaped you, you slept 8 hours. But when we look at it, it's very light sleep. You don't get into the deep sleep or dreaming sleep, and you're interrupted a lot. Okay? Now, for us to remember, when we wake up, we have to be up 2 or 3 minutes. Okay? So I remember getting up twice last night to go to the bathroom. I got to walk all the way over there, turn on the lights, look out the window, go eat something, right? You remember that, but you don't remember how many times you woke up to change position. My back hurts, so you have to wake up for 3 or 4 seconds, change position. I got phlegm, I got snot. I wake up to cough. I don't remember doing that. Okay? Or I wake up in a panic. I'm giving a lecture tomorrow. What time is it? 3:30. I'm okay. I don't have slides. I just fake it when I get there. They won't remember. They're not videotaping me. I'll be all right. No one knows me. I'm a lawyer. I'll sue them. If I knew this, I would have not slept last night. Okay, so, underlying event. You have this problem. We know it. Okay, unfortunately, our treatment is limited. But, what can we do to protect you? What can we do to avoid further trauma? Okay, as we get older, everything we do right now is related to, we're growing older as a population, so we're paying more attention to things. One of the things we're paying more attention to is obstructive sleep apnea. Now, I have this argument all the time. Animals do not snore. I know your dog snores or your cat snores, but that's because you made them fat. That's because you got domesticated, right? But animals do not snore because they would give their position away in the wild. They would get eaten up by predators, okay? If you're in the Green Berets and you snore, they kick you out, okay? Because you're giving away your position in the jungle. Okay, if you sleepwalk in the Navy, you're kicked out. Guess what? They don't walk you off the boat, and you don't call them a boat, by the way. Remember, I trained in San Diego, you don't call them a boat. Also, if you sleepwalk, because we've had military people try to get out of the service on medical, the key is if you sleepwalk, you never walk with your hands out. Only in the cartoons. So remember that. But it's one of those fascinating things. Is that good or bad if you sleepwalk? Okay, not a good idea to be on a destroyer if you sleepwalk. Okay, so those are the things that the legal field, the military have not figured out. They're always behind us, and we're still trying to figure that out. But obstructive sleep apnea is very common, especially as we age. Most common sign is snoring. And the way we measure snoring is how many doors do we have to close before we stop hearing it? You know, are you a 2-door, or are you 3-door? Some people are housers. You hear 2 houses down. And it's very disruptive. They say, I feel okay, but it's not normal. Just because everyone does it doesn't mean it's normal. Apnea is breathing pauses. Okay, remember we talked about Annie not having oxygen for 6 minutes? Imagine if you stop breathing 100, 200, 300 times a night for 10 seconds or longer, and your oxygen level drops. That has to create some brain trauma. It creates excessive daytime sleepiness, cognitive dysfunction where you have memory problems, attention deficits, concentration. Now we have to be careful because what are you going to blame it on? Your primary problem, right? It always goes back to that, and you have to be careful. We don't want to fall into a trap where we blame everything on the first event. What else is happening? That happened 20 years ago. Unfortunately, we've gained 100 pounds since then, and our nose is crooked, and we drink 6 beers, and we smoke 2 bags. So it's something else. So we have to look at all those things. That's why we reevaluate you. People increased risk for high blood pressure, heart failure, arrhythmias, ischemia, coronary disease, myocardial infarction, nocturnal asthma, cerebrovascular disease. Nowhere there did I say anything about encephalitis. Okay? This is all stuff that we develop later on in life. This is stuff that we need to avoid. We can't prevent what happened, we can't take it back, but we need to protect ourselves. We need to protect what little we have left, and I don't mean that disrespectfully, but the damage has been done. What can we do to protect it? It's like smokers. Stop smoking, stop smoking. In 7 years, you will be considered a non-smoker, and you will protect what you have, but the damage has already been done. And that's a problem we have as physicians, because patients stop smoking and then they get worse. They start getting cough and they get sick all the time, and they say, see what happens when I don't smoke, and they gain 30 pounds and they blame it on us. But the damage has already been done. And the treatment for obstructive sleep apnea is wearing a machine. Anybody here wear a machine? I do too, I hate my machine. You love it?
Yes.
God bless you, I hate it.
You have to dream wear a mask.
But you have to sleep on your back if you
No, you can sleep any position you want.
Yeah.
That's a misnomer. Yeah, you just gotta have a long tube. Okay, we haven't found anything better in 35 years. Very effective, it works. We're living longer, so we're paying more attention to sleep. Remember, what happens if you don't use it 1 or 2 nights?
Feel terrible.
Terrible, right? It hurts. You don't die, but it hurts,
You're
okay?
exhausted.
Because you're waking up frequently during the night, you may be having episodes where your oxygen level is dipping. And before we were saying, well, it's okay to skip 1 or 2 nights. Now we're saying, maybe it's not a good idea to skip at all. Been around for 35 years. Now, I don't like it and because of vanity. It does help me, I just don't want to do it. So every morning I hide it in the closet. So if the police come to my house, I don't care if they find alcohol, drugs, or pornography. That's not mine. That's my grandfather's. I'm not old, and these are not reading glasses. Vanity. I hope I look good on camera, by the way. So, okay, if you look at the list, indications for sleep studies, nowhere there says your condition. You say, wait a minute, how come my condition is not there? Because that's not, insurance doesn't pay for that, but we're looking for other things. I know what you have, you give me a history of what the event, what led to where you are right now, but we're looking for other causes. And so I would try to make sure you don't have any underlying condition that can make what you have worse. And I hate to say underlying condition, but it's just one of those things, what can we do to improve sleep? We're living longer, we're talking about exercise, we're talking about diet, we never talk about sleep. What's the first thing everyone here sacrifices to get things done? Sleep, right? Like if I get here until 9 a.m. for this meeting, we had to sacrifice sleep. To get our social life in, we sacrifice sleep. And maybe that's a bad idea. Everything we talk about now is related to sleep.
Well, let's give up TV, wouldn't we have more time for sleep?
Yes, but then I would not be happy. I watch like 8 or 9 hours of TV. You know why? There's no paperwork involved, and I don't have to talk to TV. TV doesn't ask me for money. Well, sometimes it does, the commercials. You just have to turn it off.
It convinces you, you have all these disorders that you have to be treated for.
Well, okay. And that's a common complaint. Darn it, all these drug companies are out there inventing drugs, and then they invent a disease to go with the drug. What's the latest one? BED. Binge eating disorder. I go, I got that. I don't eat all day, then I'm going to binge at night, of course. But, so it's one of those things. But in sleep, I didn't care because we didn't have money for research. So when there were commercials about restless leg syndrome, everyone made fun of it, or insomnia, or Abraham Lincoln with the diver for Rosarum, the melatonin one. That was good for me because that made increased public awareness regarding sleep disorders. Okay? If they come up with a medication for you and they have commercials out there for you, that's a good thing. Increase awareness. Okay? I know it's commercially driven, but at least it creates awareness for us. And in sleep, that was a big deal because we don't have money. Most of our studies in the beginning were done on 10 people. 10, 12 people. Based on what they found on 10, 12 people, everyone else in the country said, let's go with it, let's try this, this is a good thing.
Is that what you call statistically significant samples?
That's what we call, that's all we got. Remember what I said in the beginning, in sleep we kind of thought about stuff, we speculated. A lot of times we were really, really smart, other times we weren't really, really smart. This used to be my license plate.
Nice car, by the way.
Well, I had crashed it, so I had to give it up. It saved me from the ticket. I got stopped by a state trooper and he was laughing when he got to my car and he asked me, where I'm asleep now. He goes, I snore. And so he didn't give me a ticket and I kind of... The problem is I couldn't go anywhere without people knowing I was there. So if I was at the supermarket or somewhere I wasn't supposed to be. And this is my thing to change. But I was so proud of this because my kids, obviously 20 years ago, we went to McDonald's a lot. And my name, you can't see it too small, but my name was on the placemat for McDonald's. And my kids thought it was a big. Any questions so far while I switch over? I hope I can switch over.
Can you comment on, I don't know if I've got the term right, but the hypnic jerks, or whatever it is, that when you startle yourself awake as you're falling asleep, what are they?
Normal. Okay. What he described was hypnic jerks. And we all do that. There's a lot of stuff that we normally do. Okay? We all have wet the bed. It's just we outgrow it. We all have night terrors when we're young. We all have nightmares. We outgrow it. Hypnic jerk is that transition. We're awake, and then we're going to sleep, like in this conference, and then you wake up and you jerk, and you look around, make sure no one saw you. Okay? That is normal at the beginning of the night. Now, if you do that all night, that's something else. That's myoclonus or periodic limb movements during sleep, and that disrupts your sleep. Anything that disrupts your sleep, now we're saying it's a big deal. For example, I used to have a droid. And I'll be here talking to you, and it would go droid, and I would look down and try to ignore it. Okay? Now, if it only happened once, we'll be okay, right? But if you droid, and everyone keeps looking down, and I keep trying to ignore it, where was I? Droid, what did you say? A hypnotic droid. So, you know, eventually I'll finish the lecture, but boy, that was annoying, that constant interruption. So what we're talking about is like little pokes, little rousals. You can't, if I tell you wake up 300 times, you're going to tell me that's not true. I say, yes, it is. It's just you didn't create awareness because you were up only for a few seconds at a time. So it's just one of those things that now we're paying more attention to sleep disruption. We're also paying more attention to switching stages. Remember that slide I showed you? We're supposed to go into sleep and then 90 minutes dream. Well, we keep switching up and down. You're theoretically still asleep, but it's very light, very fluctuates a lot, so you don't feel rested, even though you were asleep for that long. So we're paying more attention to shift changes and all that. Hypnic jerks are completely normal. Yes, sir.
2 questions. The people that need less sleep, are they getting more REM sleep quickly?
I don't know. That's a good question. Now, you got to be careful. People say, I don't need less sleep. I was in the military. They taught me how not to sleep. Well, that is not true. Okay? Unfortunately, we all need sleep. It's just we sacrifice sleep. Thomas Edison, sleep is a waste of time. It's stupid. I sleep 2 or 3 hours every night. You know, I don't waste time on this. Well, guess what? He was always found asleep in the closet or under the table, but he never slept. Now, that is genetically determined. So you may come from a family of long sleepers or a family of short sleepers. Okay? You may come from a family of morning people, morning larks. Or you may come from a family that night owls. I'm a night owl. So that's a problem as a physician. You know, they want you in the hospital at 6 in the morning. No, I can be here at 2 in the morning, but not 6 in the morning. Like this lecture at 9, I'm like, oh, it's going to kill me. But it's just one of those things where it's genetically determined. Now, part of it also is our habits and our lifestyles, but it's genetically determined. Now, you might, and that's why I tell everyone, don't chase that magical 8.1 hours. I'm not sleeping 8 hours. Do you know anyone who's sleeping 8 hours?
I do.
Oh my God.
I try to get 9.
I want to join this group. Now, but you know what? That is good. Brain rest. Okay? You're smart. Okay, now every time I give myself a speech, I said, you want to be smarter, sleep more. You want to lose weight, sleep more. You want to be nicer, sleep more. Everything is tied to sleep and sleep deprivation. Now, is there anyone from high school here? I need a high school kid. Something's wrong with the computer. I need a young person. No offense.
Is it a Mac or?
Where's the,
What about menopausal women that wake up like 50 times at night, that truly wake up?
okay, menopause.
In a pool of sweat.
Right, menopause is bad for women and good for me. What happens is, with menopause, the female hormones provide some protection. After menopause, all of a sudden we see females who have more obstructive sleep apnea. They wake up more, they have more sleep problems. So it seems like estrogen provides some protective role. Now, why did I say it was good for me? Because they are sleeping so poorly that they're paying attention to their husband right next to them. All of a sudden, he is the enemy. He snores a lot, he starts breathing a lot, and things that didn't bother you years ago, it drives you crazy now. You hate him. You absolutely hate him, and that's when I get a lot of referrals. You've been married for 20 years, but you hate him now because you are not sleeping well because of the hot flash and all that.
Well, do you have to sleep together with him?
Again, bad for me. What happens if they take separate bedrooms? They fixed the social marital problem, but they didn't fix the health problem. Okay, I need the wife in there complaining. On average, it takes 7 years to get to the sleep center. Now, sarcastically, they said, you guys always find something. Yes, we do. Because when you come in, it's a done deal. We don't do screening tests. I wish we did a screening test before you got married, before high school, college, before the military. When we do a sleep test, it's usually your first one. If you grind your teeth, and I say, oh my God, you grind your teeth, and you say, how long have I been doing this? I don't know. You did this year, but we don't have any baseline on it. So I wish they come here. Sleeping in separate bedrooms is a bad thing for me. Okay. Now, and it's very common. A lot of people do that. The kids are go out of the home. They have separate bedrooms. They're not mad at each other. They're not in a bad marriage. It's just they're more comfortable sleeping in their own room. They have different schedules. They have different TV programs, and that's okay. But remember, 99% of my referrals are spouse-driven. I need the spouse to complain to bring it. Usually the spouse complains, and then they go on a golf trip or a meeting like this where they have to share a bedroom, and they say, oh my God, you almost died last night. And then just because their buddy told them to come, they come. But not because the wife told them for the last 10 years. So most of our tests are positive because of observations. We depend on history. If you show up with 3 people in the office, I will not talk to you. I will talk to the witnesses. Is he grouchy? Is he smart? Is he not smart? Does he fall asleep? And you'll be tremendously offended because you're saying, oh my God. Because if you ask me about me, I'll tell you I'm perfect. I'm a machine. You ask my staff, oh, he's disorganized, he's forgetful, he's crabby all the time. What are you people talking about? I'm going to fire your asses right now. We're going to eliminate that, right? Delete that, please. I was trying so hard not to cuss.
So I have an autoimmune form of encephalopathy, or post-encephalitis, and I find that when I'm going into a flare, I start to need really excessive amounts of sleep. Like I'm just constantly tired, and I could easily sleep 16, 18 hours when I'm in that state. So why does the body react that way with this increased need for sleep, if you know?
Healing. Remember, that's when growth hormone is released, that's when we repair our cells, that's when we slow down. Remember, what happens when we go to sleep? Our temperature drops. We cool down the engines. We can't continue at this pace. So when we're sick, we release all these inflammatory cells. The body is fighting the infection, so it has to shut down. That's why we need bed rest. Okay? We don't say, I'm sick, let me stay up all night, let me sweat it out. As a matter of fact, one thing that we've noticed too is bad to take the flu shot and then stay up. For example, if you're a midnight worker, say, I'm going to get that flu shot now and then I'm going to work all night. That's a bad thing. That'll make you sick. So you need your rest when you get the flu shot. So if you notice that you're sleep deprived when you get it, or you stay up later, you may get sick that year versus other years, okay? Everything, now, years ago, we were speculating about these things. Now the science has come back. You guys were right. Nowhere has the science said we're full of baloney. Nowhere. We said sleep deprivation, bad sleep causes headaches, causes high blood pressure, causes you to gain weight. Remember that one? Okay, now we know that if you don't sleep good, the hormone that makes you feel hungry is up, and the hormone that makes you feel full is down. Okay? Someone touched the button here. One of those people did.
Can I ask the second question?
This is not your second question.
It is.
Yes, thank you. Go ahead. You can ask as many questions you want. I don't think I have a quota here.
Does everybody have apnea events in the night?
Yes, we all have a little bit of apnea. It is normal to occasionally have nightmares. Occasionally, it is normal for a heart to skip a beat. It is normal for a heart to have to stop for 2 seconds or drop it to the 40s. Okay, what is the problem now? Everyone's wearing these Fitbits, these little gadgets. Everyone has electronic stuff in their homes. So you're freaking out when you see your blood pressure being low. You're freaking out when you see that your heart rate goes down really low. But that is normal during sleep. It is normal when we first go to sleep and we have those hypnic jerks. It's also normal for us to stop breathing there because our body's trying to slow down, and then we wake up and the body wakes up all of a sudden. So by definition, 30 times or less over 6 or 7 hours is considered normal. Okay? Good. So you can't freak out. Now, if you have alcohol, it'll make it worse. Yes, ma'am.
How do sleep aids, like medications, and that affect the sleep patterns? And the apnea, the REMs, all of that stuff?
Well, every time we try to manipulate nature, nature comes back and bites us, okay? Dreams are good. Let's give medication that causes people to dream more. Guess what? They freak out. They have nightmares. They can't handle it. Oops. Tagamet increases slow wave sleep. Slow wave sleep is very good for fibromyalgia and growth hormones. Let's give this. Well, guess what? Side effects. Men get male breast. Side effects. So every time we try to manipulate the percentage of sleep, we get in trouble. Okay, but we now know part of our problem is we don't know what's normal. What's normal for a 50-year-old? What's normal for a 60-year-old? What's normal for a 70-year-old? Right now, we're saying normal for a 70-year-old to have 0 deep sleep. So when you come to me and says, I want to sleep like a baby, I say, no, you can't. You're 70. When you were 2 years old, you have 40% deep sleep. That's why when your grandkid or your kid falls asleep there, you kick them and the music is loud. And they can't get up because they're really deep in sleep. But as we get older, unfortunately, our sleep gets more fragmented. We also have a little arthritis. We have a little bladder. We have sinuses. We worry about kids, our grandkids, ISIS, Iran, the cable bill, the car. So we have all these things that can affect sleep. Now, I cannot fix the underlying traumatic brain injury, but it's what else can we do to help you sleep? This is inexpensive. We want to avoid a stroke. We want to avoid high blood pressure. We want to avoid medication. Going back to your question, we have all these medications, but there's a dirty little secret. Yeah, we can knock you out, but you're the type of person that wakes up, I don't feel good. But you slept 8 hours. I don't feel good. Well, because they take away a lot of stage REM and deep sleep. Okay, they depress them. So even though we knock you out, you don't get the deep stage of sleep. Also, they may linger during the day. So you may still be hungover from your sleeping pill from last night right now. Okay, especially as we get older, we don't metabolize as quickly as possible. So you have to be careful. Even the over-the-counter ones, those are dangerous because you assume they're safe, and they can linger in your system. Oh, even the video guy's going to ask me a question. Now you're going to fix that, right? You're going to edit this?
Yeah. What if you aren't sleeping, and you're not sleeping, and you're getting up all the time? Then what happens to all this?
Okay, now, I saw someone yesterday say, I didn't sleep for 36 hours. I said, that's impossible, you can't do that, or you'll die, you'll burn up and die. Part of our problem is misperception of our sleep, okay? Some people say, I don't sleep a wink, and then we take them to a sleep center and we videotape them and they're snoring away and they don't think it's them, and then we have to show them that the name on top of the bed and all that stuff. Part of it is misperception of sleep, but a lot of it is unrealistic expectation. People want to sleep 8.1 hours. Like, when did you ever sleep 8.1 hours? You got 3 jobs, you got this responsibility, you got to take this kid to school. You're smoking at night. A lot of people self-medicate, okay? Let's say you smoke 2 packs of cigarettes. I ask you, are you doing it for fun? Or are you self-medicating? You have to think, you know, I'm falling asleep at 2 in the afternoon, what am I gonna do? I'm gonna go outside and smoke a cigarette, get away, I'm gonna drink coffee. So, if you are smoking all day or drinking coffee all day, these are drugs, how do you stay 6 or 7 hours without it? So you have severe withdrawal. So a lot of people get up in the middle of the night, they have to drink a little coffee or they have to smoke. It sounds counterintuitive, but they can't go all this time without their medication of choice. So now we have them wear these Fitbits. These Jawbones Fitbits, because they kind of measure sleep. Now be careful, they don't measure deep sleep. They're based on movement. So if I'm up here talking, it knows that I'm awake doing this. But if I'm watching TV without moving for 3 or 4 hours, and I know I do this because the TV says, we're going to turn off with no activity in 4 hours, you have to shake the remote. Oh my God, I better prepare that lecture. Same thing with this. Oh, you were sleeping. No, I wasn't. I was just watching TV. So we have to be careful with that. A lot of it is misperception. A lot of it, you have to look at your lifestyle, medications. We do very bad things, including me. We eat and then we go to bed. That's a bad thing. We go to bed worrying about stuff. We're congested all the time. We work too much. In our society, we want to work till 11:59, and then at midnight I want to be in bed, and then I want to get up at 6:59, and I want to get up at 7 with my clothes on and just go straight to work. We can't do that. We have to be like little kids and have a little ritual and slow down. Yes, ma'am.
I had a question that, I have a routine, like every day I set the time, 10 o'clock, I sleep till the morning, but it's like, I have weird dreams, like, it's like I kind of, like in my sleep, it's kind of like the next day what's gonna happen.
And does it come true?
I ask my mom 90% of the time.
I hope you don't dream about me getting to next day.
But it's like I can think about the day next is gonna come.
Is that a good thing or a bad thing?
Sometimes it's a good thing and sometimes it's a bad thing.
Yeah, some of us are wired that we can't shut it down. And that's what makes us successful. We're doing 1,000 things at the same time until times to come down to shut it down, and we can't. And those are people who have insomnia. People who can't shut down their brain. We have medications for that. We don't know if that's lucid or vivid dreaming or lucid dreaming where you can control your dreams and all that. But a lot of our lives are routine, so we kind of know what we're going to do tomorrow. So if I'm dreaming, I got to give that lecture tomorrow, and I'm dreaming what I'm going to say and what I'm going to wear. Oh, it came true, right? Wearing this. So it's just one of those things. That's not a bad thing. And I have all the books, 10,000 interpretations of dreams, and it's always funny, the things they make up. We don't know. We don't know. Okay, that's the bottom line. But you read these things, if you dream about a pencil, it's because of sexual dysfunction, like, oh my God, no pencil in my dreams. They make it up. If you dream about this white flower, someone's going to die in the family, oh, I wonder who. Made up, okay? Dreams, well, years ago, they thought dreams were bored, so the brain is making up stories to stay busy until you wake up and get outside stimuli. Now, current theory is maybe the dreams is integrating what we saw today. I need to learn today. I only have so much brain or computer chip in there, so I need to sort it out what I'm going to keep, what I'm not going to keep. Okay, because I can't keep everything. That's why I may integrate what I saw yesterday, which I think is going to happen today, and I make up a little story, or I summarize it to keep it here, because I can't keep the whole thing. Okay, so that's what we think now. It's memory integration. I used to study wrong. I used to wake up 3 or 4 in the morning, get up to study for medical school, and now I'm reading like, oh my God, this was totally wrong. The way I should have studied is I should have stayed up, studied, then go to sleep, dream about it, and then in the morning review my notes. And the retention rate and memory and learning is better that way, instead of what I was trying to do, wake up at 3 in the morning and try to memorize it for the test. Okay, so even for learning, sleep is very important. Okay, if it's not disturbing you, if it's not waking you up, you're not freaking out, it's okay. That's just you. You know, some people have lucid dreams. Some people can control their dreams to a certain degree.
Well, speaking of those really realistic dreams and reality, I mean, I noticed since I got sick, sometimes
Correct, and it depends on what part of your brain affects. Remember, people with narcolepsy, it affects a certain part of their brain, so they see things. They see things with their eyes open, so they're thinking, am I going crazy? They're actually dreaming with their eyes open. So it's one of those things when they go to the doctor says, you're crazy. You have a mental illness, schizophrenia or bipolar. The sad part, and it's getting better, but years ago, by the time you saw me in consultation, you had 3 or 4 different diagnoses of mental disease. Because you went around telling people you had hypnic jerks. You went telling people you saw things. You collapsed when someone made you laugh. So it was one of those things, you kind of looked like a crazy person until someone figured out it was narcolepsy. So it could be what part of your brain affected. It could be that you're dreaming. And that's why you have a hard time differentiating between, is this real or not? Yes?
Yeah, to kind of follow up on that, when I first got sick for probably, at least 6 months to a year, I had a terrible time trying to figure out the difference between dreaming and being awake. And I would think back about what happened earlier and I wouldn't be able to tell, did that really happen or did I dream that?
And try telling somebody.
Try telling a doctor in 10 minutes, all that.
Yeah,
On
so
typing it.
do people in your profession have any understanding of how it is that a human being differentiates a dream from real experience, like the mechanism, how that happens?
We know where we think it happens in the brain, but again, the on and off switch may not be as strong. So you may have what we call a toggle switch. Your switch is fluctuating. Like if I go to the back room and start messing around with the light, so you may be off. Your toggle switch, instead of being on and off, very exact, you may be fluctuating. And it's almost like you're half asleep, half awake. And most of us have done this where someone's talking and you're like, excuse me, what did you say? And you fell asleep with your eyes open and you don't even know you did it, or you missed your exit. But you're daydreaming. No, you fell asleep with your eyes open. Someone who gets ill, depending on what part of the brain it affects, may cause that. We know very little. It's fascinating. I remember this from my anatomy class. The professor said, and he had a model of the brain here. He said, take your body away, leave your brain, and the brain is studying itself. It's looking at itself, trying to figure out, how do I function? What do I look like? And that always stuck with me, how fascinating that is, how we're looking at these 3 pounds and trying to figure out, what is this? How do I function? What is this important for? We still don't know. I mean, it's fascinating, but be careful with these books that do dream interpretation and all that. It's not true. Not true. Or we don't know. No, they can't pinpoint exactly. Yes, sir.
Can you give us some rules of the road for how, if you don't have a sleep disorder, but you're saying sleep is restorative or healing or preventing a bad, what are the rules of the rule? I assume
Very radical. Very radical. It's so radical, I don't do them. Go to bed at the same time every night. Okay. If you're not going to do that, at least get up at the same time every day. Now, in America, we don't do that, right? We're sleeping on the weekends. That's a problem. We have a very circadian rhythm of 24 hours. As we get older, it gets more and more delicate. Taking a nap right now will throw us off for tonight. Daylight savings time. Just switching that 1 hour, there's an 8% increase in car accidents. Just 1 hour throws people off. The bedroom. The bedroom should be for sleep and sex. And if you're married, just for sleep. Take away, most of our bedrooms are panic rooms. They're control centers. We have a computer in there. We have a washer and dryer in there. We have a mini refrigerator. We have a laptop. We pay our bills, guns. It's incredible. It's like, no, you got to take all that out. Those blue screens, just having your desktop or laptop, that blue screen affects your sleep. Just going to the bathroom at night, turning on the light, that affects your circadian rhythm. So we tell men, be in the dark, you're going to miss anyway. You shouldn't get mad at you. So you have to be, as we get older, it's those silly things, the light. Having these lights on, having the TV on. Now, some people sleep better with TV, and I'm not going to argue with that. But TVs now have timers, so they can turn off automatically. Pets. Some people sleep with 5 dogs. If that provides comfort for you, and it's okay, fine. But if the dogs get you up 10 times a night, maybe not so good. Okay, but again, I never win that argument, I will not fight because I sleep with the dog too. And it's just disturbing when I'm cuddling the dog at night. What's going on here? Don't tell anyone, dog. No, they don't ask me for money and they don't. It's just one of those things, most of us are messed up by choice. I know I'm not supposed to eat late, but guess what? I'm eating pizza real late, and I'm staying up late watching the same program I've seen in a long time. I only slept 3 hours last night preparing something I was supposed to do this morning. So maybe I'll take a nap today, which will mess me up. And, you know, and the thing is, as we get older, we don't recover as quickly. So we're permanently jet lagged. Okay, it sounds weird to say that, but we're jet lagged. We're off schedule. Everything is tied to our body clock now. It's crazy. And we used to speculate this, but our skin, spleen, liver, breast tissue, our bowel movements, if you pay attention, they always occur about the same time. Okay? And our GI system shuts down at midnight. We always talk about bedwetting, but you never hear someone, oh, I pooped in bed. Right? So it shuts down. We have a circadian rhythm, but our body's very sensitive, and if we go off that, it throws us off. So pay attention of all your systems. Everything is on a circadian rhythm of 24 hours. Anything we do that throw that off will mess us up, especially as we get older. It's very simple. A lot of us would do better. I know I should be drinking 5 Pepsis a day, and I do it, especially at bedtime. Well, guess who's going to pee a lot and going to be up a lot? Caffeine lasts in your system 5 to 7 hours. Oh, it doesn't affect me. Well, guess what? It does. Okay, alcohol. No, alcohol doesn't affect me. Guess what? You're going to have nightmares. You're going to pee a lot at night, and you're going to wake up somewhere you're not supposed to be. Is that my dog? I hope it's my dog. Another dog. Oh, boy. How do I get out of here, dog? No, that's not. I hope you're editing this. I'm going to have to go to court and say, are you going to believe me or you're lying honest? Any other questions? Yes, ma'am.
Since my son came down with encephalitis, at night he has the most horrible night sweats and then cold sweats. His neurologist isn't sure what's related to sleep and what's related to his encephalitis. Suggestions?
What did it affect here? Did it affect his temperature center? Remember, everything is up here, so it depends on what part of the brain affected. Are his hormones off? His thyroid, cortisol, okay? Schedule. Maybe he would benefit from melatonin. Again, trying to strengthen circadian rhythm. Okay? Would that help? Something as simple as taking melatonin. Now, we used to do melatonin wrong. What did we tell you years ago? Take melatonin at bedtime. And now we're saying, oops, maybe that was a mistake. Melatonin is not a knockout drug. Okay? Now we're saying melatonin, we should take it like 6 p.m. every night. Think of it as a vitamin.
Okay, great.
Take it every night, even though we know it's not a vitamin. And remember, when the sun goes down, that sends a signal to my brain to start creating melatonin. So when I go to bed at 10, 11 o'clock, the melatonin level will decrease slowly. I don't give it at 11 o'clock, say, boom, go to sleep. So you might want to do that, see if it's strengthening the circadian rhythm, its temperature control. That's a temperature, it affects his temperature center. Yes, 5? I thought you were raising your hand. I got 5 more minutes. 5 more questions. I can make it up.
I was going to say something about that, about the temperature. I used to have things like that as well, but I also didn't know the difference between hot and cold water. You're talking about temperature. It took me a few years to be able to know the difference between hot and cold.
I'm sorry, Dale's making me nervous turning off all the lights. I need a ride home. Okay. No, I was like, is it time to go? Did I drink too much? I need a ride home.
I thought it was time to go to sleep.
Someone needs to take me home.
If you were here yesterday, I was the person saying that I was up for 36 hours. So at some point during the 36 hours that I functioned continuously, somewhere at that point, I slept.
You have to, you can fall asleep with your eyes open. Like if we had you on a monitor,
Yeah.
and you say, I didn't sleep 36 hours, say, you know what, we saw pockets of you sleeping here with your eyes open and stuff. And they've done this study years ago on truck drivers. They would hook them up, and they're driving down the road, and like, did you sleep? No, not at all. And you see they were sleeping here and there, especially in the middle of the afternoon. I'd rather drive on the turnpike at night than in the middle of the afternoon. But that's our, remember, that's when we're sleepy and we don't even know it. And that's when you start, you know, just being off and yawning a lot and having to take a coffee break. Now, where did the coffee break come from? That was the coffee industry. They came up in the 50s. They pushed until they made it into an institution where all the employers now, all the industries have a coffee break. But that was the coffee makers who came up with that in the 50s. Yes, ma'am. Cataplexy we treat with old antidepressants. Now here's the problem. You drop like this, you see things when you're awake, you're dreaming awake. So they say you're a crazy person, they give you an antidepressant, okay, to treat your crazy stuff. The thing is, that was working on the cataplexy, and they thought they were treating a mental illness, but it was literally treating your cataplexy. That's one of the older treatments. Now we have Xyrem, GHB, which is a misnomer, the date rape drug. It's very effective, but it's very controlled. Like if I prescribe that for you, I write the script gets faxed to Pennsylvania, and the medication gets shipped to you from Indiana. It works, but it's very controlled. Now, people who may have a traumatic brain injury and you're acting like narcolepsy, or what we call you have secondary narcolepsy, would you benefit from a drug like this which helps you sleep better and deeper? The problem is getting it through the insurance and all that. Remember,
It's called it narcolepsy, so if it's cataplexy, it's also narcolepsy.
well, secondary, cataplexy is one of the symptoms of narcolepsy. So you can have plain old narcolepsy or narcolepsy with cataplexy.
Okay.
But if you're having all this,
Cataplexy by itself?
yes, you can. You can. But then we have to look and say, why are you having cataplexy? Okay, and the Xyrem works very, very well, but it's very controlled because of the government's perception of misuse. If you get caught misusing that, it's like being caught with heroin. The penalties are very severe. Now, having said that, I may have 25, 30 patients on it. They're doing well. They're supervised. They're doing well. And again, we don't have a treatment for what you have, and that's why we have to push the envelope. That's why I said some of you may be acting like narcolepsy. So do I go into my narcolepsy tree and say, okay, instead of calling it this, if I called it this, would I treat you this way? Okay, so what do we do? What do we do? You can't give up. You got to push. A lot of what we have in sleep is because the patients pushed us. They looked at literature. They said, let's try this, let's do this. They're the ones who pushed us to do it, to do stuff. Okay, and then the government says, oh, now we give FDA approval for this. Like, duh, we've been doing it for 10, 15 years. Because we had to, we had nothing else. Yes?
Right, I have a question. Do you have any advice? You know, you said you're a night owl. I am definitely a night owl. I grew up in Poland, and the way our schools worked was we had so many kids, so we had a group that started at 8. I was in a group that started at 11:40 a.m. every day for the first 15 years of my life. I loved it.
You're talking Poland, Ohio, or Poland, Europe?
Europe. Anyway, so.
Who knew?
Anyway, so I am a night owl. My brain seems to function really well around 10, 11 p.m. That's where I can get the best work done. But I'm still expected to be in the office, I think, in the morning. And do you have any tips on how to switch from night owl to whatever?
Well, first of all, do you need to change jobs? I mean, now in our society, we're 24/7, where you can go shopping at 11 o'clock at night, or get your dry cleaning at 11 o'clock. Now, some industries or some jobs, you can't do that, right? Like, I would love to work at night and not come in the morning stuff. Melatonin might be a thing for you, or light therapy, okay? Buying a little box, and in the morning, you have to sit near it, read the newspaper, watch TV, which you don't do, and you have to take it in for 20, 30 minutes. What we're trying to do is shift your clock this way.
Okay.
You're acting like a teenager. If we leave teenagers alone, they'll go to bed at 2, 3 in the morning and sleep till 12. The problem is school gets in the way, right? That's when we see them for the court order. And then as we get older, grandma and grandpa go to bed at 7 p.m. Grandma and grandpa don't have insomnia, they just go to bed too early. You know, they wake up at 1, yeah, you went to bed at 7. So they're sleeping in the wrong hours, okay? Young people sleep 2 to 12, and as we get older, we shift early. That's why we can't go to parties, or, you know, 9 o'clock, I'm done. So it's one of those things that depend on where you are in your life. Some things we can't change. I'm a night owl, and I know better Come 10 o'clock, it's too early. 11 o'clock, it's too early. 12 o'clock, it's too early, a little bit more. But it hurts, especially as we get older. So it's a matter of creating discipline to do that. But light therapy is a natural treatment, but you have to do it in the morning. If you do it at night, you mess up.
Actually, the alarm clock that slowly rises up.
Yeah, but that doesn't, that's to wake up. That's noxious. We're talking about resetting your clock. Now, grandma and grandpa, guess what? We give them the light box at 6 p.m. to wake them up, to try to push them back. Don't go to bed this early. I have a 94-year-old patient who has insomnia. No, she sleeps all day.
Yeah.
You know, and it's up all night in the nursing home, and it's driving everyone crazy. You know, she had the curtains drawn. You know, it's one of those things, you open the curtains, you know, get that sunlight, stay on schedule, no naps during the day. Remember, every time you sleep during the day, you're sleeping from nighttime. Some of us, it doesn't affect, others it does. So it's those little things. Yes, ma'am?
So if a person wants to use melatonin to do this sort of shifting of the sleep schedule, so
That was me.
how would you do it? Like, say, I can never fall asleep before midnight and I really need to go to sleep sooner than that. So what would be your, say if you want to go to sleep.
Where do you live?
Where do I live? I live in the Chicago area.
Sorry to hear that. Very expensive. My daughter lives there. Trust me, I'm paying for it. So, yeah. Yeah, I'm very sorry to hear
But
that.
I guess I mean, like, so how many hours before you're
6 p.m.
6 p.m. and then,
Daylight. Go by the sun.
okay.
If the sun is going down at 6 p.m., you want to take the medication then. Melatonin is not a knockout pill. Basically, that's setting a signal to your brain, start creating the melatonin. And it's usually 1 milligram or 0.5 milligrams. We were doing this wrong. We were giving 3, 5, 10 milligrams. So now we're saying, that was wrong. Less and earlier. Okay?
And then, do you need to then stay on that as a regimen, or in time, will the body just?
You need to do it at least for 3 weeks, 3 to 4 weeks. Now, what's the problem with Chicago and Ohio? It's winter. Winter, it screws us up. You know, so it's one of those things where you need to do this every winter and then take the summer off. Summer, you're doing okay. You don't need a problem. So it might take 3 or 4 years to figure this out. But that is a simple, inexpensive treatment versus Ambien. What's the problem with Ambien? It's a good drug, but people are sleepwalking. People are doing crazy things on it. It depresses stage REM. Okay, so maybe it's not so good. Okay, again, us, that's a condition. I'm sorry? Well, the problem is it's hit or miss. Trust me, if all that stuff worked, I wouldn't have a job. You know, valerian root, kava kava, lavender, those things would help, but a lot of it is improving our lifestyle. Most important thing, like you were asking, we got to go back to childhood, have a little routine, put on my pajamas, take a bath, then put on my pajamas, read a little book. Not a Kindle, not the iPad, because the light will wake me up. A real book. Slow down. Most of us, including me, I want to turn it off right now. I don't have time to do this ritual and brush my teeth and
Have you
floss.
ever tried one of these? It's like,
No, I hate those.
rain crickets. It fades away after whatever time you set it to.
Oh, that sounds terrible. I would be like, bathroom's on, is that my bowels or? Isn't it funny how you like waterfalls, it's soothing, but if your toilet is, it drives you nuts? I said, what's the difference? It's water falling. Yes, ma'am, all the way in the back, sorry.
So after I had encephalitis, I required a lot of sleep. You know, I mean, in my recovery, I'm sleeping at least like 10 hours a night, and I just don't feel like I function without that. And I kind of want to get back to the way I was, where I'd sleep 7 or 8 and be able to function. Is there a like a recovery path where people after an injury?
No, that would be too easy. Everyone has their own schedule. Now, having said that, you can't fake sleep. Unless you're in bed, like some of my patients, 15 hours to sleep 5 hours. You can't do that. So it's very inefficient. Now, are you up a lot at night? Are you watching TV, or are you sleeping the whole time?
I'm sleeping.
Because right now, your body may demand that. You're still recovering. But you may also want to get a sleep study to see if there's anything else going on, just in case. Now, let's say you go and have a sleep study done, and they find absolutely nothing. Like that darn doctor told me to have a sleep test, and there was nothing there. Guess what? Now we have a baseline. There was nothing there. You don't have sleep apnea, you don't have restless legs, you don't have myoclonus, you don't have the hypnic jerk, you don't grind your teeth, you don't wet the bed. So now we have a baseline in case something 2-3 years down the line. So getting a sleep test now, even though you don't do any old bad thing, you're saying, I'm not back to where I am normal. It's been 6 months, it's been a year. What's going on? We should do a baselining to see what's going on. I wish I had a sleep test on all you guys. And then that way I would put it in the bank or here. If something happens in the future, I can pull it up. Worst thing is having no comparison. If you ask me, is this normal? I don't know. This is you today, at this age, at this weight on these medications. I don't have a sleep test from before the traumatic event or the incident. You're telling me you slept 7 or 8 hours. I have to believe you because that's what you're telling me now. Is that true or not? Your parents might say, no, she always required a lot of sleep. She was tough to get up in the morning. You know, she slept all the time. Remember, our perceptions may not, and I'm not calling anyone a liar here, it's just our perceptions regarding sleep may be off. I'm awesome. You know, I'm awesome. Why do I have to read things 3 times? Why do I forget things? Why do I miss my exit? Why is my staff always mad at me? Why did I forget this lecture? Like I said that? And then I said something, I was going to make it fun and interactive, and I said that? Did I really say that? Did I really say that? I did? And you remember, that's the sad part. Like, I really said that? Yes.
So, how long does it take the brain once someone shuts their devices off? So, you've got the iPhone, the iPad, or the TV. You're watching your funny cat videos.
We don't know, but we say you should disconnect at least 30 minutes before, which is hard for everyone to do because you want to check your cell phone one more time. You want to check the iPad one more time, your email one more time. But just that blue light, let's say I don't even check it, just this, I'm going to sleep with this on, that affects your sleep.
Right.
Okay, that can advance or delay your clock. So someone like you can't have this. You got to have complete darkness. Now it's okay to have that special alarm that just like the sun coming up. And, I had one that was supposed to like perfume and all that. I don't know, it's in the basement somewhere. It's too much work, I don't know.
Well, then the birds start singing.
And the crickets.
And then I traveled with a coworker who's sorry, and she set we were in the same hotel, and she set her alarm clock 6:30 in the morning. I thought the place was on fire.
What was that?
I don't know, like why do people do that to themselves?
Well, a lot of us need obnoxious noises. Just back there, can I see that far?
No, I was stretching.
Oh, you were stretching? Yeah, I was paying attention. Proud of myself. Dan, was it your turn yet? I hate to. You should never steal time from the next speaker.
Yeah, well, we're having a breakout session.
Well, you should never steal from the breakout session. Enjoy your breakout.
So we got to see, but I have one sort of philosophical.
Is it a lawyer question? Because I hate
It's
those
not a
lawyer
lawyer
questions.
question. If it was a lawyer question, I would have backed up much. It's related to where people live in terms of latitude on the planet. So obviously if you're on the equator, your day-night does not change the seasons. Those of us that live higher up, like Wendy and myself, we live fairly high latitude, so we have a very short day during the winter and a very long in summer.
Yeah, but Dale, tell them where you live.
I live in Syracuse.
Oh, I thought it was San Diego.
I grew up in San Diego.
I feel bad for you then.
San Diego is very.
That's worse than Chicago, by the way.
But Wendy lives in Vancouver, so we're up fairly high. So we have short days in winter and much longer days, very long days. It doesn't. The reason I thought of this was like set your clock at 5 o'clock, but in the summer we have to set it at 10 o'clock.
Right, and that could be a problem. So, but in the summer you may not have a problem. So you got to figure out. It may take 2 or 3 cycles before you figure it out. I thought you told me you were from San Diego, so I was going to make fun of you. And they've done studies, people, because you know we're jealous. People in San Diego, they got the beach, they got the sun. On average, they're out 1.5 hours a day. So even though they have the beach and the surf and all the sun, they have to work like us. They're indoors all the time, so they're not surfing all the time like we perceive it. So they only are outside 1.5 hours just like us. Circadian rhythm is the most important thing. You have to take into consideration where you live. I visited one of my partners. He lives in Alaska right now, and he's trying to convince me to move up there. Every resident gets a check for $3,000 in October from the oil. Sarah Palin shops in the same grocery store. You can hunt, you can shoot. And I said, yeah, but 6 months of darkness, man, I can't handle it. Now, the suicide rate is high in Alaska, and you would think, oh, six months of nighttime. No, it's during the daylight, 6 months of days that they have more suicides. Okay, so Alaska's not the best one.
Well, I have a similar, I have a colleague who lives in Oulu, Finland, which is near the Arctic Circle. So they really have almost no sun in the middle of winter, and almost all sun in the summertime. So they have complete shut from the sun.
It'll be fascinating to see what the suicide rate is there. And I think this is the international table, Poland, Sweden. Well, I thought it was like one of the happiest countries in the world.
Actually, Poland is where I live now.
Every time you say Poland, I bite my lip because my kids are half Polish, and I blame them. Every time something happens, so your Polish side. Not your Hispanic side, it's your Polish side. Yeah. Thank you.